Hey, hello everybody. This is Dr. Chen. As you can see, I'm here on campus and we're wearing masks. Maybe I'll take out a mask for a little bit just so that you can hear me. Hey, want to say hi to Coach B? Coach B.
Hey everybody. Good to see you.
Yeah, there you go.
Looking forward to when you're back here soon.
Good, good, good. All right, let's take a walk. And I just want to bring the campus to you because as we're gearing up to open the campus to bring our students back, I just want to say how much we miss our students and our PacBay family. And this video, as you will see in a moment, is really designed to train our students and parents, and also even faculty too, to sort of how we can come back nicely and safely. So I just want to say that we're excited, and the staff, teachers, and administrators have worked so hard around the clock to get this campus ready. But we're excited that there's a possibility to repopulate our campus with students' presence. We miss the vitality and the energy. So here we go. Enjoy the video. Thanks a lot.
Hello, Mr. Chan here, and we're excited to have your children return to campus in the upcoming weeks. There are a couple of things we need you to do at home each day before your child can come to campus. The two things we need you to do as parents each morning is to take your child's temperature and to answer a screening questionnaire for each child. When checking your child's temperature, we ask that you do it each morning before submitting the online form. If your child has a temperature of 100 degrees Fahrenheit or higher, you must keep them at home. If you have multiple children and one of their children has a temperature of 100 degrees or higher, we ask that the entire family stay at home until the school office can contact you to get more information. The at-home screening process will be done on the Safety app by Auxiliary Services, or AUXS. The app is available on Google Play and the Apple App Store. You will need your child's temperature that you took in the morning, and it must be completed prior to leaving your home. The at-home screening process begins when you select a child. Please select the child you are completing the form for first, and then continue answering the questions as you go down the screen. At the end of the screening process, you will receive a safety pass. A green pass means you are cleared to come to campus. If you get a red campus, don't worry. The school just has a few questions we want to ask you before you can come to campus. So please remain at home. If you have multiple children, remain at home with all your children and await further instructions. When you arrive on campus, you will have to show your green safety pass. Sometimes you will not be able to keep the app open on your way to school. So in order to view your safety passes for the day, you can click on the top right corner of the app. There's a little icon with a little man. It looks like an ID. If you click on that, you'll see all of the safety passes for the day. So if you have multiple children, you can show them all there. Now you're wondering, how do I get this safety app? Well, invitations to the safety app will be sent out later this week. Please be on the lookout for an email from safetyapp@auxs.org, as it may be filtered into your spam folder. A reminder, a smart device is required to complete the at-home screening questionnaire, so please contact the help desk at pacbay.org if you do not have access to a device that can download the app. Thanks for helping us keep PacBay safe. Looking forward to seeing everyone soon. Mrs. Valladares will be showing you what to expect when you arrive on campus.
Hi everyone, we can't wait to have you all back on campus. What I'm going to do is I'm going to take you through the route that you're going to take, and so you will know where your drop-off checkpoints are, your drop-off and pickup checkpoints are. So follow me, let's go. You will enter at your normal entrance, like where you normally do, over here at our entrance. If we tell you that your first checkpoint drop-off location is in front of the community center, you will go and make 2 lanes, and you're going to go all the way to the end of your lane. At that point, there will be a person there that's going to first check to see if you have your green ticket, which will be from your app showing that you have you're good to go green. And then we will take their temperature to confirm that in fact they are below 100. And if your student is, then they make it out of the car and they will go to their location. So that's that point. If we tell you that your checkpoint drop-off location is in front of the gym, this is where you will go. You will come all the way down over here toward the gym. You're gonna make 2 long lanes. I'm on the right side right now, but you're gonna slowly go all the way toward the end. You will find somebody there. They will tell you to stop. When you stop, what you will want to do is you'll want to show the person checking you in that in fact on your phone you have gone through all the questions and that you have the green ticket. At that point, your student, we will take their temperature. We will confirm that in fact you are fall within the range that you're supposed to fall, and then they will be able to get out of the car and go to wherever they need to go. If you are a student, and this will be the same pickup and drop off. If you are a student driver, Mr. Bonilla will let you know exactly where you need to check in. He will also give you some forms that you need to complete, giving you permission to park on our campus and to drive. Parents, what you will do is after you've done your checkpoint, you need to go make a full circle all around the campus, drive slowly, stay in one lane. People try not to cross each other. We're going to be patient. You want to come on time so that you're not rushing through the campus to get to work or to get off our campus. And students, as you know, your parking spot is over here on this side, is your parking location. So that's it. We can't wait to see you all back on campus, and hopefully this was a helpful video. Take care. Bye.
Hey, 4th and 5th grade families, wellness sessions this Friday afternoon. Bring your lunches and stop on by. I'm going to give you some instructions on drop-off, and the same instructions will apply for when we have classes, hopefully starting next Tuesday. You'll come in your car up around the school building just like last year, past the bridge, around the corner, and down here to the front of the school, and you'll just line up here behind this crosswalk where I'm sitting right by the front of the building. And it'll go really fast because you already have done your PacBay safety app checklist and checked everybody's temperature at home. There's a quick, easy form that you fill out on the app each day. You do the student safety screening, and then it'll give you a green ticket you could have on your phone screen ready to go when you arrive at school. Just show that to the person checking you in through the car window, and then roll down the window. We'll do the student temperature check with a touchless thermometer, of course face masks on and all that, and the students can get out and go in. 4th graders, you're going to go right in these double red doors right here behind me and go to the classroom on the middle floor, and that was the 5th grade classroom last year. And 5th graders, you're going to go in the bottom floor, the red door that was the kindergarten entrance last year. If you forget that, we'll tell you when you get here, so no worries. But everybody will just check in from their cars right here in the front of the school. And parents, sorry, but we have to ask you to stay in your cars, at least for the time being, until things loosen up a little bit as COVID becomes less of a risk. We really appreciate all the adjustments everybody's making through this difficult time, and really look forward to seeing you soon. We'll try to make education a priority, and obviously safety also will be a top priority as we phase in to reopening. Hey, see you Friday, I hope. Bye-bye.
I'm going to talk a little bit about the process that is in place when someone comes onto campus, whether it be a student or a staff member that is exhibiting symptoms that potentially could be associated with COVID-19. We have adopted a process and a series of policies that are fully compliant with California Department of Public Health and San Mateo County Department of Public Health guidelines for responding to suspected incidents of COVID-19. The process is relatively elaborate and involved. So let me begin with some slides. Okay, let's take a quick look at the chart that sort of shows the flow of how events would move if someone became symptomatic at PacBay. If you look at the top line, the purple line, this is where someone presents with minimal symptoms, sniffles, runny nose, maybe a headache, low-grade temperature. We're going to ask that person, whether it's a student or a teacher or an employee, to go home. We're going to ask them to stay at home for 72 hours and to monitor themselves 72 hours at least. And we will clear them for reentry if after 72 hours, without taking fever-reducing medication such as Advil or Tylenol or aspirin or some other fever-reducing med, if they are symptom-free and without a fever for 72 continuous hours, they can return to campus. That's if someone presents minimal symptoms, maybe loosely associated with COVID-19, but could be just the symptoms of sinus or cold or stomach upset or something else. When we get into this dark blue band, that is where we begin to move into the realm of symptoms associated with COVID-19. And we're going to use this second chart, the screening response flow chart, to assess whether or not the person is presenting with symptoms that could indicate infection with COVID-19. And you'll see there's 3 boxes along the top. And we're going to use those 3 boxes to make a determination. The first is if the person, student or staff member, presents with a temperature between 100 and 100.3 degrees Fahrenheit and has a symptom that does not necessarily trigger a screening under criteria A or B. Those are the 2 boxes to the right. So there's a temperature and there's some symptom that does not necessarily trigger the criteria to the right. We're going to take that person and essentially do what we did with regard to the mild symptoms. We're going to ask that person to go home. We're going to ask them to remain home until they have 3 days, 72 hours without a fever while not taking fever-reducing medication. And no further symptoms. So the symptoms have dissipated, the fever has dissipated, and the person has not been taking fever-reducing medication. Again, that's Advil, Tylenol, that sort of thing. And while that person is awaiting pickup, if it's a student, we're going to place them into the isolation room, which is located over in the gym. That's the area that used to be the counseling room. The counseling center is now relocated to the Seville campus. There's now a counseling office and a counseling area up on Seville. So that old counseling room is the isolation room. It's sanitized and it has a direct access to pickup so that whoever is in the isolation room is not mixing with the student population and can be directly transported to the car when it arrives for pickup. And again, that person's going to be asked to go home, see a doctor if appropriate, and it has to be cleared by 72 hours of continuous, no fever, no symptoms, no pain or fever-reducing medications. The second criteria we're going to use is what we call criteria A, triggering criteria A. And if the person presents with one of these symptoms, we're going to refer them immediately. We're going to send them home and refer them immediately to medical attention. And that's going to be cough, shortness of breath, difficulty breathing, or lack of smell or taste. Lack of smell or taste. This chart actually has a typographical error. It says small. It should be smell or taste. Studies are showing that people that have COVID-19 infections in large numbers lose their sense of smell and taste upon being infected with the virus. If you have one of those symptoms, you're going to be sent home. The staff member or student will be sent home with express direction to immediately contact their physician and to seek both an assessment and to submit to a COVID-19 PCR test. Now, it's very important. There's a number of different types of testing for COVID-19, but the most reliable testing system and the one that we will accept for using for purposes of clearing people back onto campus is the PCR test, which is the one that is probably most widely used. It tests for genetic material related to the antigen. And that particular test is the one that's used, for example, by Kaiser Permanente and also by San Mateo County. Criteria B would trigger that response if two of the following symptoms are observed: a temperature of greater than or equal to 100.4 degrees Fahrenheit, and or a sore throat, or chills, or muscle pain, or fatigue, or headache, or congestion with or runny nose, or nausea, or vomiting, or diarrhea. Any two of those symptoms, we will send the person home with an express advice to immediately contact their physician for assessment and for the administration of a COVID-19 PCR test. Those are the three screening criteria that we will be using. Now, what happens if someone is during this testing process or screening process hits one of these triggers? First and foremost, if you test or have criteria A or criteria B, we are going to ask you until further notice to go into isolation. Isolation is a state that is defined by the Center for Disease Control, the CDC, and we're going to ask you to stay in isolation until you are cleared by your physician and get the all clear from a COVID-19 negative test. Now, isolation means you have to stay at home except to get medical care. You should be monitoring your symptoms, and if you have one of the emergency warning signs, such as trouble breathing, to seek emergency medical care immediately. You should stay in a separate room from other household members in your home. You need to use a separate bathroom if that's possible. You need to avoid contact with other members of the household as well as household pets. You should not share personal household items like cups, towels, and utensils. And if you do have to have interactions with other people in the house, you need to wear a mask when you're engaging in those interactions. Okay, so now what do we do if you've been sent home, you've been referred to your physician for an immediate assessment and a COVID-19 test? And if you look on the far right end of this flow chart, you'll see there are three blue boxes, one light blue, one kind of medium blue, and a dark blue. Those are the boxes that pertain to how you are cleared to come back onto campus. So if you are referred and you receive an alternate diagnosis, in other words, you don't have COVID-19, you've been diagnosed as having acute sinusitis, or you've got bronchitis, and the physician has confirmed that, then you have to go for 72 hours without a fever and without symptoms, again, not taking fever-reducing medication. And then you're going to submit to us a clearance to return form that's been signed by your physician. When you are sent home for the assessment, We'll send you by email a package of material which will give you some guidelines on either isolation or quarantine. In this case, you'd get an isolation packet. It'll give you the sort of rules on regulations from CDC on how to self-isolate. And included in that packet will be a PDF document called Clearance to Return. And your doctor simply has to fill it out, check the box upon which the clearance is based, sign and date it, give it back to you, and then you can email it to us, a scan of it to us, and we will clear you to return back on campus. On the other hand, let's assume that you are you're tested for COVID-19, you have the COVID-19 symptoms. If you test positive, then you're going to have to remain in isolation for 10 days from the date the symptoms first appeared. And then upon 10 days, the county regulations require that you wait an additional 72 hours to make certain that there is no recurrence of symptoms or fever. Once that occurs, again, you have your physician fill out the clearance to return form, send us a scan of it, and we'll clear you to come back onto campus. If you test negative, then you're going to have to wait 72 hours without fever or symptoms. Again, without using fever-reducing medications. And if that occurs, then your physician can execute the clearance to return form. Again, you send it in, and we'll clear you to come back on campus. Those are the protocols for returning, and you'll see the form asks the doctor to fill in some information and to indicate among the alternatives the basis upon which you are being cleared to return to campus. Now, the last situation, which on this chart is shown in pink on the bottom, is if you have had a known exposure or close contact with someone who was either tested positive or was exhibiting symptoms and tested positive for COVID-19. So you have had a close contact with that person. And the CDC has a definition of close contact. It means one of 5 things. 1, you are within 6 feet of someone who has COVID-19 for a total of 15 minutes or more. You provided care at home to someone who is sick with COVID-19. And remember, these are people who have been diagnosed either by test or by physician assessment as having a COVID-19 infection. You had direct physical contact with a person who had COVID-19. They hugged you, you kissed them, you shook hands with them. You shared eating or drinking utensils with an infected person who has COVID-19. Or when you were in the presence of a person who had COVID-19, they sneezed, coughed, or somehow broadcast from the nose or mouth respiratory droplets on you. That could be somebody singing, somebody speaking very loudly. That would be a close contact. If that happens and you get that contact and you're aware of it, or we're aware that you have been in contact with somebody who has been diagnosed with COVID-19, you're going to be placed in quarantine for 14 days. So quarantine requires 14 days before it is concluded. And when you are in quarantine for 14 days, you have to stay home 14 days from the time you had contact with the infected person. You have to check your temperature regularly and watch for a fever of 100.4 or higher, for cough, for shortness of breath or other symptoms of COVID-19 during that 14-day period. If you have them, you're supposed to contact your physician immediately. And you have to stay away from other people who are at high risk for getting sick from COVID-19. The elderly, people with immune deficiencies, people who are diabetic, people with hypertension or high blood pressure, people with cancer, people in chemotherapy. You have to stay away from those people while you are quarantined. Once the 14-day period has run and you have not had any symptoms or any fever, then the rules again in San Mateo County require you to make sure that you have at least 72 hours of no fever, no symptoms, and no use of fever reducing medication. At that point in time, you can then have your physician complete a clearance to return form for you. Again, when you get the quarantine packet from us, it will have the clearance to return form attached to it. And that's the process. It's, as you can tell, a reasonably complicated one. It's one that has a high degree of care and really attention to detail. And we hope we never have to use it. But if the situation arises, we're prepared for it, prepared to make sure that the safety of our students and our staff is really our highest concern at all times.
All right, students and families, here you have it. It's the first of many training videos that we'll be making. Again, this is just one small bit of the school policy and the procedure for coming back on campus. You want the more thorough look on the entire procedure. It is on our website. It is also on my PacBay. Please download the COVID reopening plan called the Collective Resilience and read that carefully. Well, we're excited to bring students back. As you can see, we're ready and we want to be safe. And it's not just about preparing the space and the campus, but rather, but also, more importantly, is that you and I are familiar with the procedure and the policy, and that we do our part out of abundance of love for one another. We want to keep each other safe and healthy, and also be able to come back together and learn together. All right? Have a wonderful day. We'll see you soon.